Knowing how to identify and prevent pressure wounds, also known as pressure ulcers, is a vital part of every caregiver's toolkit. Sometimes called decubitus ulcers, or more commonly, bedsores, a pressure wound is an injury to the skin and underlying tissue. There are two main causes for pressure wounds. 1, pressure on the spot of the body for too long a time, and 2, friction on the skin. Pressure occurs when a person is lying or sitting in one position for too long. Pressure of the body against a surface, like the seat of a chair, reduces blood flow to the skin and surrounding tissue. This in turn stops the flow of oxygen and can cause damage to the skin and tissue. Friction occurs when skin is dragged across a surface, like when someone changes position or is moved or repositioned in a bed. If a wound is discovered, take note of the approximate size and if any drainage appears. Once you've identified that someone has a pressure wound, the next step involves calling the individual's healthcare professional to discuss next steps. But take note to identify if there's drainage from the wound, if there is a smell, and if the injured area is moist or dry. Observe for signs and symptoms of infection: fever, pain, hot, red, drainage, and odor. The person's medical history is also a key factor in assessing not only the wound, but how the injury will be treated going forward. Does the person have a history of pressure or friction injuries? Are they getting enough oxygen? Do they have numbness or loss of feeling anywhere? Do they already have another infection elsewhere? Here are areas of the body that have a higher risk of breaking down due to pressure and friction, like the back of the head, shoulders, tailbone, elbows, hips, knees, heels, ankles. A good practice is to check these areas frequently, especially if the person you're caring for is elderly or has a mobility impairment, a history of pressure wounds, or bowel or urinary incontinence. Be sure to pad bony areas with pillows to prevent pressure in between the knees, ankles, under heels. Turn frequently to relieve pressure on hips, tailbone, back of the head. Use the wheelchair tilt every 15 minutes to relieve pressure. If you see a reddened area, keep pressure off that area. If it does not resolve, call the individual's doctor. While regular daily inspection of a mobility-impaired person's skin during bathing or dressing is the best way to ensure early detection of pressure wounds, there are several things one can do to prevent skin injuries, including staying hydrated and eating a healthy, nutritious diet, and repositioning a person while in bed or a wheelchair. Inspect bony areas daily. When a person is in bed, gauge head elevation and keep it as low as possible without sacrificing comfort to reduce the impact of skin friction due to gravity or shearing. Shearing wounds occur when forces moving in opposite directions are applied to the skin. Pay extra attention to positioning the person to minimize pressure and friction, shearing over the heels, elbows, base of the head, and ears. On the heels, tailbone, and bottom, these are most at risk for a shear. Use a draw sheet when possible to move the person in bed. Be prepared to help a person change position at least every 2 hours, and more often every hour if they are at risk of pressure wounds, to relieve pressure on the more susceptible parts of their body. Additional steps can be taken as well to maximize comfort and reduce pressure, like using pillows under one side of the back or as cushions under the knees. Pillows or cushions can also be placed under the feet and ankles to alleviate friction on the heels. When assisting the individual, avoid dragging their heels, hips, bottom, and tailbones across sheets, and use lifting devices when repositioning. Wheelchair users should shift their weight and adjust their sitting position every 15 minutes, and their seat cushions should be checked regularly for signs of wear, proper inflation, and proper placement. Inspect the wheelchair daily as well to ensure it's clean and devoid of sharp edges and surfaces. Ensure clothing is smoothed to prevent a pressure area. Caring for a person's skin, from keeping it dry and clean to properly moisturized, applying lotions as prescribed by a medical professional, will help prevent skin breakage and damage. Once identified and assessed, pressure wounds need to be treated according to their severity. While topical treatments should be sufficient for most superficial pressure wounds, open sores require dressings and medications dependent upon the severity of the wound that need to be monitored, changed, and applied daily as ordered by their doctor. There are a wide variety of topical medications: gels, foams, liquid skin barriers, sealants, and wound drainage kits, and dressing types available for treating pressure wounds, and whenever possible, you should consult a trained healthcare professional to guide you in creating a treatment plan and schedule. Please visit our website to learn more about caregiving resources and training.